Welcome back to the Outward Expression. I'm your host, Roman. Previously, I had made mention that uh, in one of my earliest videos that I had been a healthcare provider for more than 30 years, and I thought it might be useful for me to flesh that out a little bit. And I created a bit of a short video basically saying that I had intended to flesh out that idea a little bit and why that was relevant to this channel. And having said that, I'm going to go ahead and try and do that this morning for you this afternoon, and maybe give you some insights into what a 30-year career in bedside patient care has taught me about life, and maybe I could impart a little bit of insight to you and help you to understand that how this channel, um, how it is relevant to this channel in terms of this channel's mission, which is basically the idea of the outward expression, the expression of the outward person is a reflection of the inward person. Um, so having said that, I want to start out by saying that my career had a very interesting trajectory. My career began in the 1990s during a time in which the AIDS epidemic was pretty much everywhere in big city hospitals, and that was my introduction into the industry. I'm a respiratory therapist licensed in my state, and I've held my license for over 30 years without blemish. I'm proud to say, I'm very happy to say that. Um, that time was marked by a lot of uncertainty, both in the medical staff and in the nurses and technicians who worked with patients. We were not quite sure what we were dealing with. So, having said that, the circumstances were challenging, and as I look back upon it, quite revealing about the nature of man's disposition towards his fellow man. Um, it was quite a challenging time, but in the 1990s, I'd say that the profession, just healthcare professionals, were, I think, of a disposition that was more humane than we find ourselves in currently. There was a camaraderie and a sense of ease and um, freedom as a practitioner to do what needed to be done. The uh, the industry itself had not become fully in the grasp of the other interests that sought to wrest those powers from the people at the bedside. Uh, so it was an interesting time. I had a lot of fun. I began my career at the University of Illinois Hospital on Taylor Street. I was there for quite a while and enjoyed myself there. I met very interesting people, some of whom I still are in contact with today. Uh, the the nursing units were populated with young professionals as a rule, and whenever you have young professionals, always it's always helpful to have seasoned professionals, doctors, nurses, technicians, administrative staff that had experience that was useful in that particular environment. And on the other side of that bookend, and having presented that side of it, the end of my career in respiratory care uh, is quite recent and came on the heels of the events that took place in 2020 through roughly mid 2023, and we all know what that was. So I will not expand upon that except to say that the environment changed dramatically. And where there had been courage, and autonomy, it seemed to me that was replaced with fear and adherence to protocols and dogma. And that's unfortunate. So I'm just going to leave that alone. And I hope that for those of you, and I suspect that there's probably a number of you in my audience that are healthcare professionals that may have had similar observations. I'd be curious about what your thoughts are about that. And I'm not going to labor the point too much, except to say to you that my personal experience and where I was practicing at the time, I saw in an ability to maybe explore different avenues for patient care that would have perhaps yielded more favorable outcomes than that which we were mandated to adhere to. And it's rather unfortunate. I think that in just an overall appraisal of that, it was regrettable, and there was a lot of undue suffering. And I'm going to leave that alone for now. But I think, I hope that there's people out there watching this channel who know what I'm getting at. I suspect that some of you have had similar experiences. And for those of you who may be at odds with my appraisal, I challenge you to please help me to understand what it was that I was missing, because it seemed to me that certain things were off the table and forbidden to be even discussed in polite company. So, having said that, that 30 years gave me a lot of experience. I learned a lot of things about human nature and about people and about myself. And one of the things I learned is that when people are in circumstances, hospital settings, where they are expecting certain things to be carried out, they will often perhaps exaggerate situations in order to get a greater, more quick response from the person serving that particular unit. What I mean by that is, let's say I'm a respiratory therapist, and in my experience in hospitals, respiratory therapists are often assigned to more than one nursing unit. They'll have 2 or 3 floors, maybe more, maybe an emergency room or surgical suite, whatever the case may be. But if you're not on the nursing unit and a nurse desires your presence to address a certain circumstance, they may from time to time exaggerate the urgency. And that's a dangerous thing to do, because basically once you've done that, you've established a set of circumstances and when you're in which your credibility begins to become diminished. So I think maybe I'm hoping you know what I'm getting at. Let's say, for example, I'm in a hospital and I'm on the west end of the hospital, and the person on the east end is demanding me at a bedside for an urgent circumstance, and it turns out that the circumstances were much less urgent than they portrayed. That initial encounter begins to diminish that particular nurse's credibility. And over the course of a number of months, weeks, years, whatever the case may be, the credibility of the entire profession becomes diminished. So if you start to have a pattern recognition where you notice that certain members of staff are exaggerating the circumstances, you become indifferent. But on the other hand, your indifference cannot lead you to inaction. So although you may be indifferent, you've already learned your lesson that likely this particular circumstance is not what they've made it out to be. Your actual action and response to it still has to be proportional to the perceived urgency. So that's kind of what that is. You'll find that, or what I found is that um, you start to get a whole different perspective on the industry itself. I have to say that 30 years, I was never out of work. I enjoyed the work that I did. It wasn't always um, exciting, but at times it was, and other times it was less than exciting and perhaps even terrifying. And and one of the things that I think that's relevant to this channel is that the way you present yourself in terms of your outward expression is important in those circumstances, and particularly in your professional life, whether you be in in healthcare or in food service, you know, maybe entertainment, whatever the case may be, whatever industry if you're in, if you're a bank, whatever the case may be, that your response to the stimulus around you should be appropriate and professional to the best of your ability. And I'd like to think that I succeeded in that in large measure. Probably not always the case, because there was, as you probably know, you being in healthcare, those of you who are out there in healthcare or in service industries know that there are times when you are understaffed to a point where you feel that it is entirely inappropriate for the circumstances that you're trying to address. So, in having said that, I'd like to say on the whole, I did my best to always be professional. At other times, when the burden was maybe a bit more than anyone could be reasonably expected to bear, uh, maybe not so much. But I'm hoping that that is forgivable, and that it didn't characterize my professional career in respiratory care. I will say this though, that on occasion, um, on more than one occasion, when I entered into a nursing unit, I was met with a round of standing ovation, which I probably didn't deserve. To be honest with you, I probably did not deserve that. But that standing ovation was in response to the fact that the nurses in that unit were relieved to see someone who they knew was dependable, reliable. I'm not super therapist. I'm not um, your really high level respiratory therapist, but I showed up. I showed up. I was available. I was competent. I was polite, and I was effective, I think. So on those occasions when I did receive those rounds of applause, having arrived on a nursing station, it was most likely because those nurses in those particular areas were uh, less than pleased with the performances of the therapists who had, prior to my arrival, been there. Maybe they've been treated to an invisible respiratory therapist for a number of days and had grown weary of um, administering treatment and drawing blood and things of that nature that were not necessarily their role. And they knew that if I was assigned to their unit, that I would carry out my duties to the best of my ability, and that um, yeah, that's basically it. I think that I did a good job of that. Um, I'd be interested in your feedback, the people in the audience, and I hope there's people out there who are listening to me and hearing this, what your thoughts are on that. That could be true in any particular set of circumstances. If you are uh, an electrician, for example, and you're contracted to do a project, and you're there every day, you get your work done, and you go about your business. There's not a whole lot of fanfare for that, but when you go on vacation and the guy who follows you doesn't do likewise, you're going to stand out and just doing your job, just showing up, I think is really quite a bit of a leg up when it comes to your profession. And I think this message is particularly useful for people who are young and just getting started in life. As I am nearing the end of my career, um, I wish there had been someone there who could have maybe given me this kind of imparted to me these lessons. These were lessons that I don't know if I was maybe I had an inward disposition towards just being that person who felt like if they had certain expectations placed upon them, they felt duty bound to make good on those. So, for those of you who are young, maybe just getting started, nurses, doctors, therapists, electricians, cooks, chefs, wait staff, um, whatever your calling in life, whatever your vocation happens to be at this point in your life, um, you can find a lot of satisfaction in the work that you do simply by uh, doing the work to the best of your ability and inspiring the respect of the people you work with. Getting back to what I said about receiving that standing ovation. Now, that standing ovation may have been merited, but in another set of circumstances, it probably would not have come. Like, for example, I worked in a community hospital, but if I had been like at Northwestern or a hospital where the caliber uh, professional bedside care and technicians and so forth, nurses, doctors, technicians, whatever case may be, might have been at a higher level, my performance may have just faded into the background and just been another face in the crowd. And it's important to remember that. So if you're in a circumstance like that, perhaps, just perhaps, if it's in you, maybe step it up a little bit if you want that recognition. Um, so yeah, that occurred to me that might be a useful bit of information for you. So again, this whole conversation that this whole presentation, I guess, that I've been trying to share with you is basically just my observations on 30 years in healthcare. I don't really think I've even scratched the surface, but I think I have touched upon some key themes that might be useful. Um, and helpful for people who are interested in professional development as a human being. And that's basically the outward expression. I guess the pretense or maybe the thin edge of the wedge is fashion and um, clothing and so forth. But the larger message, the more pertinent objective here is to inspire people to do a little bit better, and maybe perhaps I'll even inspire myself to do better in my current position. Um, Everybody needs to, from time to time, get reminders, and sometimes those reminders come from outside, and other times those reminders are things that you remind yourself of when you sit back and reflect upon your life and the things that you've done. And those reflections are best done frequently. And I hope that I've given you something to think about. And I hope that you've enjoyed this presentation. I hope that also that you will subscribe to my channel, like my channel, and follow me. I actually, I may actually come back to this particular topic at another time, but I wanted to tie a bow on the package that I put out there earlier when I said that I was going to share my reflections on 30 years in healthcare. In the future, I'll be going back into like discussing men's fashion and maybe delving a little bit deeper into how I like to put together my wardrobe and curate my style, my own personal style. So again, this has been The Outward Expression. I'm your host, Roman. I really hope you've enjoyed this presentation. Choose the good.